Good morning, everyone. Welcome back to our council meeting. We're going to get underway right away. So Dr. Maston is going to give us a report from DERT. So Pat, I'm going to turn the virtual podium over to you.
Okay, thanks. John, if you can pull up my slides, we will get started. Let's see, a lot of buttons to push to make this work, right? Thanks, Rick. And welcome everyone. As is kind of what we do every round is we have a kind of an overview of what has been going on and what will be going on in the Division of Extramural Research and Training, DERT. So I'll step you through some of that. Before we get started, I just want to remind council members again that if you have comments, put them in the chat. We like to have an active chat going on that we can use. And I would also remind people who are listening on the webcast, if you have questions, you can use the email link national.advisory.council@naehs.nih.gov. And you should, and we'll try to respond to you as we can. Let's see, and look at that. And if I click down here, I think I can get a laser pointer. Right? Look at that. All right, terrific. So here are a few things I'm going to talk about in my hour coming up. As we always love to do, I'll give us some stuff. Some DERT staffing updates. We have some business to conduct here, and that I'll come to in a minute. And then I'll give you an overview of our 2021 DERT budget. Talk about a few funding announcements that we have out now, and then talk about some DERT activities that have happened since our September council meeting and some that will happen before our next June council meeting. And then I would like to follow up with a quick overview of some things, basically an advertisement of what we'll be doing in DRT related to climate change. So staffing updates are a kind of a bittersweet sort of thing. So we say goodbye to people that we've worked with and then welcome new folks. So we'll start with the bitter here and say goodbye to Gary Ellis. And Rick talked about him yesterday and what a great job he did as the acting director of DRT for almost a year. He was involved in a number of projects like our DEI activities, climate change, portfolio analysis that we worked on. But mostly I wanted to say on behalf of the division that we really appreciate how much of his heart Gary put into this job. Even though he was only temporarily assigned to us, he invested himself fully from the beginning. It was amazing to me how quickly he went from talking about the division as you to talking about the division as us. And so on a personal level, I just have to say how much I really thoroughly enjoyed working with Gary. And I would say if any of you have a chance to do that in the future, you should take him up on that. It has been a highlight of one of the highlights of my time at DRT. And because he was so fun to work with, he asked me to mention an RFI that has come up and that I will actually put in the, it's out from RFI on cancer related things. I'll put it in the chat when I get done here so you can see that. All right. Also kind of saying goodbye. We say goodbye to Les Reinleb and Steve Tsujime. Les started in NIH 30 years ago as an intramural scientist. He came to NAEHS and DRT in 2002. And in his time here, he has led several big programs, including our breast cancer and environment research program, as well as our environmental health science core centers. He also initiated and managed portfolios of carcinogenesis, as well as some emerging areas like tissue engineering, stem cells, and circadian disruption. So we wish Les well in his retirement. And Steve came to us as a presidential management fellow in 2016. And 2 years after that, we converted him to a health specialist. We threw him into the deep end of the pool fairly quickly. His key role was to assign every application that came into our division from CSR to a particular program officer, grants management specialist, and to a scientific topic. And not only doing that, he also worked on a way of semi-automating this process, reducing the time it takes to do this by about 30%. We wish him well in his new position with Dr. Zeldin in the Office of the Scientific Director. Both of these gentlemen brought us so much energy and creativity to DRT, and they will both be greatly missed. On a little bit of a happier note, we're pleased to announce that Lisa Edwards and James Williams have been promoted to grants management team leads. They both are senior level grants management specialists, and they will be helping Jenny Greer, who is the director, excuse me, the chief of the grants management branch, with a number of managerial activities, as well as serving as liaisons to our two big Superfund programs. So I know they're already starting to help Jenny considerably there. Next, I'd like to welcome Jennifer Baker as a program specialist in our administrative office. Jennifer comes to us with a large amount of experience from the private sector, and she actually worked with us as a contractor for a long time, so she knows us. And we're pleased to get her on as a full-time person. Among her many duties, she will be our mobile device contact person, which is an important job. Also welcome to Talon Barnes. He will be a program analyst in our worker education and training branch. Talon comes to us from the division of intramural research and training, where he was an administrative program specialist. He'll be helping Sharon and the group in worker training, helping with database and computer IT areas, as well as a backup contract administrator. And he will be continuing his activities as a member of the Unite Committee, one of the Unite committees that Rick mentioned yesterday. The scientific review branch actually welcomes two new people. First, we have Lorna Daniel, who was most recently an administrative tech, also in the Division of Intramural Research and Training, specifically the Genome Integrity and Structural Biology Lab. She'll be joining our other program specialists in helping set up these intricate and difficult to reviews, so we welcome her. And we also welcome Dr. Beverly Duncan as a scientific review officer. Beverly is a graduate of Howard University, and she spent the last 6 years working at the Walter Reed National Military Medical Center, where she assisted in education of military graduate medical students. She did 2 postdocs, one in the Uniformed Services University and then one at NCI, after doing a pre-doc dissertation with NHLBI. So she knows NIH, and you can see her areas of interest are autoimmunity and inflammatory processes. So welcome, Beverly. And finally, we welcome Susie Osborne. Susie comes from the Office of Science, Education, and Diversity in the Office of the Director. She worked as a contractor over there for a while before becoming a Fed. Her background is actually nursing, which provides an interesting perspective for us. Excuse me, she'll be moving into the program analysis branch, and her immediate task will be working on our FOA tracking system, and helping us track our grants budget, which I'm very pleased to have happen. And Susie, I saw that you had a meeting on the calendar for tomorrow morning, so see you then. Okay, well, welcome to all these people, and we look forward to working with you in the future as we go forward. So as I mentioned, I have a couple of, business things we have to work on. The first is this triennial advisory council report that deals with the NIH policy on inclusion guidelines. This, of course, we're all familiar with NIH policies about including diversity of research subjects, including based on race, ethnicity, as well, and gender, as well as age, most notably making sure children are enrolled that's appropriate. You have this report in your electronic council book, and it's also will be available on the website. I'm not sure it is yet. And I don't want to get too far before I thank Martha Barnes for pulling all this together and helping me go through multiple iterations of it. She's very, very valuable in that particular aspect. So what is the report? It includes a number of things, including strategies for ensuring our compliance with inclusion rules in the extramural domain, as well as the intramural. Extramural, of course, the study section takes this up when the reviews are happening, but we also have our own internal processes where we look at it. And for the intramural group, of course, they have their own processes as well as their IRB and so on. The report also contains approaches for training staff to make sure we're all implementing these programs and policies correctly. And it includes some inclusion data, which I will go through in just a few minutes. So ultimately, Rick has to sign this as the director of the Institute, but before he can do that, we require council approval of it. So we're going to ask you for that in a few minutes. You have this essay as your ECB, and hopefully you've had a chance to look over it. There have been changes to it, one of which happened during the 21st Centuries Act that was passed in 2016. And this includes the requirement for analysis of sex and gender and ethnicity and race, focusing not just on all clinical trials, but specifically on NIH defined phase 3 trials. And it also required the inclusion of the policy on children, as well as inclusion across the lifespan in studies. And it also moved the requirement from every 2 years to every 3 years. So what is in the inclusion data that I'll show you a little bit? It includes both the extramural and intramural data. And kind of the metric that we're working with, one metric, is the inclusion enrollment record, which is something that PIs submit as they're starting to enroll for their human studies. And of course, a study can have more than one IER, depending on how the recruitment is. And of course, within each IER, there are multiple enrollees. So I did that. Let's go to this one. So just to give you a sense of the data, this shows just kind of overall data for the last 3 years. And you can see here the total IERs that were submitted, and the numbers went up a little bit from 2019 to 20, and then went down over 21. I don't know if that's a significant change. What is noteworthy is that a number of the IERs that did not have enrollment yet, that number went up in the last couple of years. And I think most obvious answer to that is, of course, COVID, but there are other things as well, such as duplicate record changes in grant coding and variety of administrative, as well as just the natural flux. So this looks real, but hard to say that it is. Not surprisingly, most of the IERs were submitted for research that happened in the US sites, although there were some in the non-US sites as well. And you'll note that there were a larger number of female-only IERs. The reason that is primarily is that a number of these studies were child caregiver pairs, and the caregiver most often was the mother. And because every enrollee has to be listed separately, that made the number of female IERs look higher. So the data I'm showing here, and I'm not going to make you try to strain your eyes to see this, this relates to all defined clinical research at NIH. I'm going to blow this up where you can see it a little bit more, but now we're looking at the number of enrollees, not the number of IERs. So for instance, just kind of looking up here in the left corner, you'll see that we have our 3 years broken down here by sex and gender. So that, and this shows across the top the number and percentage of minorities enrolled per group. So for instance, of the 311,000 females enrolled in 2019, 72,600 were minority, for a percentage of 23%. Similarly, in that year, the number of males that were minority was 40%, and the number of those that did not give their minority, but give their gender, or that we don't have it, was 34. You can see for the females, that number seems to be going down. This is just 3 years. It's hard to know if that's significant. The number of males went up a little bit and then back down. Again, I don't know if these numbers, change in numbers, mean anything, but there they are. Kind of looking at another part of the table, again, this is broken down by year and by sex, gender. This is looking at Hispanic and Latino status. And so you can see here that of the that about 7.8% of the females enrolled for this in 19 were Hispanic or Latina, and that number stayed the same and then went down in 21. Male numbers stayed the same and again seem to have dropped down. I don't know the cause of this. Again, it may be related to COVID, but I don't know. And then finally, looking at enrollees that were African American, you can see the numbers for 19 for female were about 11%, down to about 9, stayed about the same. And you can kind of see the numbers here. So these data are concluded in this report that you have in your ECB. And then we were required to look specifically at NIH to find phase 3 trials. So I'm going to blow the corner here so you can see it a little bit better. The most noteworthy thing is that for the years 2019 and 2020, we didn't have any. And that's because we do very few phase 3 trials. And in fact, this is probably representative of one trial down here for 2021. So we don't have much data to compare to, obviously. And finally, looking at the The age distribution, this was required for all applications that were submitted in 2019. And after, of course, anything that came in 2019, by the time it was submitted and reviewed and awarded, we only have data for 2021. The next time we have this in 3 years, we'll have a comparison that we can give you. But just so you can see that about 2/3 of the enrollees were in this age range, 18 to 64. About 14% were 65 and older, and about 17 were children. Okay, so that's just an overview briefly of what is in the report. And what I need now is to ask if there are any questions that I can, maybe I can address. I can't see hands here, so I may have to have someone else to tell me if there's a raised hand. Actually, John, can you quit sharing for just a second so I can see people?
Yeah, that's what I was going to suggest, Pat. Just quit sharing. Yeah. And so if anyone has comments or questions, because I've got my virtual pen ready to go.
I know this is a lot, and it's, but yes, if you have any questions, I'll try. I hope Martha's on the line. Martha, if you're around.
Yeah, I think Irva has a question or a comment.
Yeah, so Irva.
Yeah, I don't know exactly when this was, perhaps a year or so ago, during a discussion that we had in council about diversity and inclusion. There was some discussion about certain kinds of efforts that it was thought that the program office could make in developing more applications and more actual successful applications through and a variety of suggestions were made. Oh, I'm sorry, I should put my video on. And I remember one in particular was sort of working with applicants and having even some sort of a group that would meet regularly, particularly early stage investigators. And I just wondered if some of those kinds of activities have been implemented yeah.
That's a good question. And yes, without going into too many details, we have implemented a number of things. We have I wasn't prepared for this, but we have started working with like our diversity supplement applicants to kind of pull a group together so that you can support each other and we can help them through that. I'm not sure how far along that is. I think Christy Pettibone and Melissa Smar are the ones who have been targeting that. We've also had listening sessions with HBCUs and minority serving institutions that Rick has been involved with, asking them what we can do to help. And we are pulling together that data and trying to move forward with it. It's not a quick process, as you can imagine, but yes, those kinds of things we have been working on. And we can provide you more information, but I'm clear I just wasn't prepared for that question. But yeah, we have been working on it. Yeah.
Thank you.
Well, Pat, that is a good question. And perhaps at our next council meeting, we can have a topic area where we can report back to you on the various things that we're doing. Irva, how's that sound?
Great. Yep. Terrific.
Yeah, I can tell you that Christy and Melissa and several others have a report that will be going to our senior leadership within the next month, probably. So we are moving in that direction.
And there may be elements of our REAP plan that we want to integrate into this as well. So Irva, we'll report back at the June council meeting.
Fabulous.
Okay.
Yeah, if there are any questions. Oh, I'm sorry. If there are any questions, John, can you put my presentation back up? We'll keep going.
Pat, we need that vote.
Oh, I'm sorry. Yeah, right. That should be my next.
And one other thing, Rick, you need to sign the 508 compliant version. I sent that to Mary this morning. So my apologies for not realizing that one that you have isn't compliant.
Nope, I see it. It's sitting right in front of me. So as soon as I get the vote from council, I'm ready to use my virtual pen and I'll sign it. And
great, thank you.
And so I would like to request a motion to accept this application, this report to be sent to Rick for signature. Can I have such a motion?
So moved.
In a second?
Seconded.
Thank you. Okay, any further discussion? If not, I will ask you to vote, and I'm going to look. You need to vote There are several things on it. You want to vote for the thing that says 2002 NAEHS Triennial Inclusion Report. I think it's number 3 on your list. Is that right, Liz?
Yes.
Yeah, so just vote for just that. There's also a report on there. I mean, there's something, summary statement, whatever, just for this one report is all you need to vote for. And Liz, you can let me know when we're.
Dr. Kaufmarker, Dr. Miller, Dr. Parker, and Dr. Perez Lugo. Please vote.
I'm sorry, is that number 3?
It says 2022 NAEHS
Okay, sorry.
Triennial Inclusion
That-
Report.
Okay, thanks, Liz. I got it now.
Okay.
In the interest of time, I'll go ahead and ask you to continue voting, and I'll check back with Liz as we go forward to make sure we get all this taken care of. So the next piece of business we need to talk about, oops, wait a minute, let's see. Yeah, or what are called council delegated authorities. And what this refers to is the fact that for most types of awards, we can't make the award until council approves it. But some things are just too piddly to bring to council. And so we ask you to delegate back to us the authority to make these awards without coming to you with it. So for instance, here are the 5 things that are in the council delegated authorities that, which by the way, are in your electronic council book. And these are change of institution. So if a PI leaves and goes to another institution, they can take the grant with them. A change of PI, which is where the institution stays where it is and the PI leaves. A continuation of a grant with an interim PI, which is where obviously they haven't found the permanent yet. And then 2 types of extensions, one with funds and one without. The without funds are what we call a no cost extension. So we're just asking that you give us the authority to award these without having to bring them formally to you. We sometimes add other things to it. This time it's the same as it was last year. So if I could just have a motion to approve these council delegated authorities, letting us fund these without bothering you all. And again,
So moved.
all
Oh,
right, second,
second.
great. If there's no discussion, then I will ask you to vote on the council delegated authorities.
We're fine.
Okay, great. And John, my slides aren't moving. Oh, there you go. Okay, thank you. So every February, we like to give council a summary of what we spent in the previous fiscal year in the grants line. We have to wait this long because all the books have to be closed. It takes a couple of months to do that. So just to give you a few little facts, to give you a general overview. For instance, I'm looking at the extramural funding and grant distribution. We had 1,340 grants that were reviewed, applications that were reviewed, some by our scientific review branch, others by the Center for Scientific Review. Of these, we funded 238 competing awards. By competing awards, just to make sure you understand, is any application that is reviewed by a study section is a competing award. It can be a new grant, or it can be the renewal of that grant. So at the end of the renewal time, it gets reviewed again, and that's considered competing. Of these 238, about 144 were in our research project grants. 35 were in our other research line, which I'll talk more about in a little while. 26 were small business applications, 29 were training grant applications, and 4 were research centers. So I'm going to focus in a little bit now on our research project grants. The average cost for these competing was $459. For the non-competing, it was $465. This is a little bit higher than it was last year, which is reflective of just the cost of business going up. I will also mention that we kept our pay line at 10% this year for unsolicited R01s, R03s, and R21s. I'll talk more about this in a slide down the road. And in terms of success rate, we like to track this. And for overall, our RPGs, our success rate was about 14%, which is very similar to last year. And our R01s are at 13%, which is slightly lower than last year. And I'm not sure why that is. Oh, and just to be clear, this does not include Superfund related grants. I will talk about them separately in a little while. Okay, so looking at the overall distribution of our grants, where they went, which budget line, again, we're excluding the Superfund grants, and we're looking at everything else. We funded about $384 million worth of grants last year. This is up slightly from the year before, which is a good thing. You can see clearly that most of what we fund are research project grants to the tune of about $278 million. We also funded about 10% of our budget went to research centers, 6% went to our training grants, 5% to our small business, and 7% to this other research, which I'll talk about in a moment. So in this slide, I'm going to focus just on the RPGs, this blue wedge that you saw just a minute ago. I'm just going to expand it to its own pie here. And what this shows is that about a little over 3/4 of our RPGs are R01s. Not surprising, that's the most used research grant at NIH. About a smaller amount goes to our R35, which are our river grants. You heard about this a couple of council rounds ago. This is our funding People's Not Projects program. R21s are our small research grants, and then you can see the others as they break down this way. Excuse me just a second, two things going off here. So what I want to focus on next, again, focusing on the RPGs, what I'm looking at now here, or what you're looking at, are the breakdown between competing and non-competing awards. A competing award, as I mentioned, is one that is reviewed by study section, either in the beginning or at a renewal. The non-competing is the money that's provided in the what we call the out years between the initiation and renewal. The green here represents the non-competing, the yellow or ochre represents the competing. And as this year, as most years, about 3/4 of what we spend is non-competing, which makes sense. There's about 3 to 4 years out years for grants. And you can see the numbers here. I'm going, and I say this is about the same. And I just have to mention that this is a kind of a closed system here. So as this green gets bigger, the yellow has to necessarily get smaller. So looking at how this compares to previous years, I'm focusing now just on the competing awards. So here is 2021. We went down a little bit from 2020, but we're closer to what we were in 2019. There are several reasons that this can happen. One is that if we fund large programs in other budget lines other than the research project grants, such as we did here in 2019, that will necessarily reduce what can be spent in the RPG line. So we funded the HERE program the HERE program in this year, and that reduced what we had available for research project grants. The other thing that affects this is how large the non-competing line was. And this year, I think this reduced number here relates to that, having a larger non-competing budget. This number kind of goes up and down. We work hard to try to balance it so that we can have as much money available for our competing grants as possible. But there's a natural flow in that. So as I mentioned here, both solicited and unsolicited applications are included in these data. Solicited application is one that's submitted under a funding opportunity announcement, normally an RFA, and it normally has to set aside for it. Unsolicited are investigator initiated applications, which come in under some sort of parent announcement. I'm going to focus first on the solicited grants. And these are the ones that we have released this year, or maybe I think these are all out now. And I'll just mention that some of these are recurrent ones, the outstanding ones awards, the Victor awards, our time-sensitive R21 awards, and this is the river I mentioned a minute ago, the R35s. And I believe 2021 was the first year for our research to action. And then I'll mention this briefly. We have a collaborative RFA with Indian researchers that Shri put together, looking at specifically air pollution concerns. So that was interesting. So now I'm going to focus on the unsolicited grants, still looking at the RPG line. What I'm showing here is in the ochre are the ones that fell within our 10% pay line. And if you're not familiar, the pay line basically sets a limit at below which we'll pay, almost guarantee pay it unless there's a reason not to. However, we also include money in our budget to pay things that are above our 10% pay line. And that's what you're seeing here. So in 2019 and 2021, you see the numbers were similar about what was in the pay line and then what was paid as raise to pays, or sometimes referred to as special or select pays. The number of the pay line grants was higher in 2020, and it's just the natural way things go. We had a higher number of meritorious applications in 2020. And again, it's just kind of part of the natural ebb and flow of grant applications. So at this point, I have been focusing on the RPGs, and I want to focus on the rest of our grant line here for a minute. So here are the RPGs, and here are the other things that we fund. So for instance, here are our research centers. We fund, and each of these wedges includes competing as well as non-competing. And you can see we funded about 37 million in centers and how it's broken down here. Our training grants, again, include competing and non-competing, and there are institutional training grants, T32s, T35s, as well as our fellowships. Our small business wedge here shows competing and non-competing for our SBIRs as well as our STTR application. And then finally, this other research line here, which includes a number of things, particularly our career awards, which are K, and yes, K is for career here, as well as the other research awards. And these include things like conference grants, infrastructure or resource grants like the R24s and U24s, or the U2Cs, which is what the here is, as well as our short-term training grants, R25s. Okay, so to this point, I have focused entirely on the non-Superfund research program. Now I want to switch and look at our two Superfund programs. These are the worker training program and the Superfund research program. And this, as you'll see if you were here last year, is very similar. The worker training program funded about $26.7 million worth of grants, and far and away the most were our U45 grants, with a small wedge here, which is our small business grants, which are part of our e-learning program, which are grants to support online training. For this, and the director of this program, of course, is Sharon Beard. Our research, the Superfund research program, which is headed by Bill Sook, shows a similar distribution. Most of the grants go to these P42 centers, but we also fund some R25s, which usually deal with something like environmental remediation. We also have a small business wedge here, and we have this small R25 program, which you heard several years ago, which are short-term training programs. So that's all I have for the budget. I will hold questions on this to the end, but just to give you a heads up on that. So that was the past. Now looking at the present, I want to show you some of the new initiatives that we had out this year. And these again are in your ECB, but I just wanted to point out a few of these that are worth noting. The Collaborative Centers for Children's Environmental Health Research Translation. You'll be hearing about these in a few minutes or a couple hours from Kim Gray. Those were funded back in September, and she's going to give us an overview of that. I also want to mention this program, which is a little bit different. It's called Restore, and it's dealing with the environmental effects on inflammation, but rather than looking at how environmental exposures might induce or worsen inflammation, this is looking at how they may affect the resolution of the inflammation. So this is a different take on that question. And then I will also mention the utilizing in vitro Functional Genomics Advances, the G/E Discovery. This is Kim McAllister's program, and it was designed to use newer tools such as innovative culture systems and population-based animal models to get a better handle and understand the interaction between genetics and environment in complex human diseases. So this is a very different kind of approach to a situation. I'll also mention that we had two small business RFAs, SBIR and STTR, that dealt with artificial intelligence and machine learning. And similarly, we had two small business programs dealing with environmental health literacy, both the SBIR and the STTR. And finally, I want to mention some of the programs from other ICs that other institutes and centers that we joined in. We continued our support of the Geo Health program, which is a Fogarty international program. We joined the Structural Racism and Discrimination program, which is the goal is kind of self-explanatory, is to look at how look at the role of structural racism and discrimination in health amongst populations. Our take on, of course, is focusing on environmental health exposures. And then we also joined this first cohort. FIRST stands for Faculty Institutional Recruitment for Sustainable Transformation. And this is an NIH-wide program trying to increase the diversity among NIH-supported researchers. So these are center grants, and they go to institutions based on their, to hire more diverse faculty. I want to look quickly now at some of the activities that have happened since we met in September, and some that will happen now between now and June that our staff have been involved with. So we've been fairly busy since September, and you can see there are a number of programs that we've been, other meetings and workshops we've been involved with. Rick mentioned yesterday our special council on climate change back in November. I will also mention that our worker training, as well as our Superfund research program, had their grantees meetings since we last met. And I will also note that we had several meetings in different topics, including microbiome, data science, again, structural racism, which I just mentioned, as well as several others. If you're interested in the outcomes of these, let us know, and we will try to provide information as we can. Moving forward, we have several meetings we want to bring to your attention. I won't mention all of these. I will highlight a few. There will be an Advancing Environmental Health Equity through Implementation Science meeting in the end of this month, beginning of March. And as the name implies, it's looking at implementation science in the context of environmental health exposures. They'll be looking at evidence-based prevention and interventions, and looking at emerging health issues such as climate change and disasters, and looking at community and multi-sectoral partnerships. These have several co-sponsors in addition to us, so this should be a very nice meeting. Actually, maybe I'll ask Lindsay, if you're listening, maybe you can pop the, if you have a URL that you can put in the chat, that might be valuable.
Of course, yeah, I'll put that in there. Thanks, Pat.
Yeah, thank you. Okay, we're having our, PRIME is having its grantees meeting. PRIME is the program that we started in 2018. It refers to powering research through innovative methods for mixtures in epidemiology. And as the name implies, we're looking at statistical and other kinds of methods to evaluate large amounts of mixture data in order to tease out the various effects. To date, there have been 37 novel or extended methods from the PRIME program to do this. This program is scheduled for April. And in fact, Bonnie, if you're available and want to put a link for this in there, that would be great as well. And finally, I'll just note that there is a diet and nutrition and autism meeting going on in June. This is something that Cindy Waller is involved with. They're looking at maternal diet and nutrition and how this can modify the impact of non-genetic factors, such as environmental factors, on the risk of autism disorders. So that will happen in June. And that's a virtual meeting, if I'm not mistaken. Okay, I want to finish up by talking briefly about what DRT is doing to get ready for the climate change initiative that Rick told you about yesterday and has told you about in previous meetings. most of the work that Rick talked about and that Claudia talked about in the special council meeting in November are extramural activities. So needless to say, we're preparing to staff up to try to meet the challenges of this new initiative. So I want to particularly let you know and bring to your attention that we are planning to recruit for more staff in the division, including a senior level program officer who will kind of lead the extramural program in climate change. I emphasize planning because first off, we don't have the allocation yet, but secondly, it's the government and there are things that have to be gone through to make that happen. We're also planning on standing up very soon a climate change and health office within the DERT director's office that will be led by this program officer I mentioned up here. Again, this is in the planning phase. All these staffing plans are currently being worked out, and we'll keep you posted as we can. If any of this sounds interesting to you, please contact me or Claudia, and we're glad to talk to you. Otherwise, keep watching USA Jobs, and we will put these in as soon as we possibly can. And with that, I'm going to thank you for your time. And I believe we have a little time for some questions. If John, you can stop sharing. If you have any questions about anything I said, I know I gave you a lot of information in a short time, but if you have any questions, I'll be glad to answer them as best I can, or call anyone else in DERT. We're at your disposal. Thank you. Yeah, Phil.
Yeah, thanks a lot, Pat. I'm just trying to understand as a newbie here what the scope of our support and recommendations are with respect to things like budget. You know, so for example, as I'm listening to this, I'm wondering, and this is all this is bigger picture questions than really what you presented, but the relative amount of money that's spent intramurally versus extramurally versus what goes on in other institutes, and in fact other institutions, and whether, you know, how you think about that kind of distribution, or when it comes to putting money in new programs, and whether we're supposed to have a role in that, or in any way, not necessarily dollar amounts, but recommendations for new programs. I'm sorry, it's just that I'm kind of new to this, and I mean, I just see things that look to me, and it's not, a lot of this is not my field, but it looks like anomalies in terms of how money is being spent.
It looks what? I'm sorry.
Like anomaly in the way money is being spent. I mean, some of this is self-serving, of course, but just as a couple of examples, one, it looks like less than 10% of money is spent on training, whether in fact that's the norm across NIH, or whether there's more or less than other institutes. I'm just curious about that. And then the explosion of machine learning across pretty much every field. It seemed like the amount of money, the new programs that were coming on board related to that seemed to be quite small. But, you know, again, I just observe, just trying to be helpful, but and understand what the role is here.
Yeah, so actually several questions embedded in there. I'll take the training question first, if you wish. We actually fund a slightly higher, not slightly, a fairly larger percent of our budget goes to training than most institutes. We are on the upper end of in terms of percentage. Obviously, we're a smaller institute compared to some of the others, so we don't spend as much in an absolute amount. In terms of how we decide what to fund, we have a scientific planning, a science planning process within the division, where program officers bring forward ideas on what they would like to spend, ideas they'd like to push forward. So that's typically how that's done. In terms of things like data science, I can tell you, not able to be specific, we do have one or two things in the works right now that we hope to be getting out within next year. So I'll tell you, it takes about 2 years from a concept to realization. That's just how long these things take. And we try to balance a very broad portfolio. We have everything from you know, very molecular things up to community-based policy things, as well as the kind of overlying principles of data science and that kind of thing. I don't know that we have too much in artificial intelligence currently in the pipeline, but we obviously have been talking about it now. I can't speak to where we are with those. So that's kind of a vague answer. I don't know if that touched on, oh, I'm sorry, your last question. So yes, this is the your advisory committee. So if you have ideas about areas that you would like to see pushed, we want to hear that. You can just email Rick or me directly. And you'll be hearing two concepts in a minute that are things we're talking about, and we would like your input on those as well. So I guess that's about best I can answer. Does that help?
Yeah, that helps a lot. Thanks a lot. The only other question that you didn't get to was the intramural versus extramural.
Oh,
Maybe that's a question I can address, Pat.
Thank you.
So, being physically distant from Bethesda, we have some unusual requirements. So many of the other ICs at the NIH, tap into a central core of funding to maintain their buildings, maintain their security workforce. These are all things we actually have to cover as part of our operating budget. The second thing is, so there's more money that's actually put into or taken out of the grants line to be able to maintain the, I guess, the maintenance and the repair of the buildings and things like that. The other thing I want to point out is that we're the only institute that has two different intramural research programs. One of them is very typical to other ICs. It's the Division of Intramural Research, where we have investigators who do basic biological research to better understand how environmental agents can be influencing human biology. But secondly, we have what you heard from yesterday from Brian Berich. It's this more of an applied collaborative division called the Division of the National Toxicology Program. And in both of those, being off-site, we have to have a sufficient critical mass so that they can be doing their work. So most of the intramural programs are about 10% of an IC's budget. Ours are probably closer to 15. We're not the only IC that's greater than 10%. In fact, there are some ICs that are greater than 15%. But Dr. Collins and now Dr. Tabak and Dr. Schwetz, they made it clear to me that the two intramural programs will grow no more than 15% of the total budget. So that's the limitation there. So we have two different intramural research programs. They need to have sufficient budget to maintain a critical mass, being that we are physically isolated from the rest of the campus. And the other parameter is that we have a number of budgetary requirements to maintain our facilities, our buildings, and security, and things that other ICs can just tap into as basically the support mechanisms in Bethesda. So Phil, does that answer your question?
It does, and I apologize to my other council members if this is sort of stuff that they already know, and I'm just perhaps I should take some of this offline, but yeah, that was very helpful. Thank you.
Well, so the other thing I just want to add is that, ultimately, as the director of the Institute, I work together with Pat, I work together with this group in DERT, I work together with groups in the different divisions. I have to take ultimate responsibility for what gets funded. And I value all of your opinions. In fact, we select all of you based on your subject matter expertise to be on council. So I truly see this as an advisory committee. So if there are specific areas of concern that you have, and Phil, to be honest, we chose you for your expertise in data science, and that there's going to be increasing amounts of interest in developing the tools to do artificial intelligence, machine learning, as well as develop all of the necessary databases so that you can do this seamlessly. So I value your input. So if there are things that you're hearing, you have questions that you're concerned about, I feel that you have my ear, and I'm very interested in hearing what you have to say. And if there are specific things that you want to have me as address in my next director's report, let me know, and I'm happy to do that.
Thanks, I appreciate all that.
Okay, great. Karen, I see you have your hand up.
Yeah, I just have sort of a follow-up on that. It's a Pat, thank you for going through all of that information, but it's sort of overwhelming. And I think it's, one thing that it's hard to look at sort of appropriation. So we have X amount in this and X amount in that. The bottom line is if you don't keep RO1s, for example, at 10 percentile, then you don't have a research force extramurally. So you've got to do that. But then even within that, so data science versus wet bench science versus clinical, preclinical studies, animal study, they're all the cost for those types of research, they differ so much. So I think maybe one thing that might be helpful, and I'm sure the data's there, Pat, but and Rick, but I just don't know how to see it quickly. Sort of maybe like you mentioned sort of numbers of dollars spent on various groups of grant, sort of funding initiatives. But is it like numbers, like each one, like sort of how much does it cost, right? Like this RO1 is for way over modular because it's animal studies or it's epidemiology, where this one is below because it's biochemistry. I'm a biochemist, so I usually ask modular, but biochemistry or data science, those types of things are less expensive. So I think it would help. I don't know how to do it, but I think if we saw something like that, it would be beneficial.
Yeah, and that's a perfectly reasonable question. And probably the reason we didn't do that is because I was already dumping enough data on you to add dollars to whatever. We can certainly do that. And you're right, the range of expenditure per R01 is large. I mean, I gave you a number of like 460,000 your average, but you're right, it ranges from one end of the spectrum to the other. And we can probably provide that data if you're interested. That'll be an interesting analysis. I'm hoping Christy.
I guess it would just help inform on things like sort of the questions we just had, sort of where are things going, but it's like we can't say, well, there's not enough in this area because we don't know what the actual cost per grant, that kind of thing.
Yeah, and I should mention that we are working on it. I mentioned it when I was talking about Gary Weiss. He started when we were working on an overall portfolio analysis. And I saw Christy just came into view. Her group is kind of leading that. It's we have brought pieces of that to the council and we're working on it more in depth. When I don't know, Christy, if you want to just put you on the spot, if you want a minute or two, that you want to update us on that.
Yeah, I'm happy to do that. I think I was just looking for the presentation that Gary presented back in September. And one of the real challenges to putting dollars to our grants is that our grants are really complicated. And we don't really have a good way to, because a lot of our grants do all of those kinds of science that you just mentioned, Karen, right? So it's very, very difficult to parse out on a mechanistic level, RO1s, PO1s, U13s, whatever, what we're doing. And so that's one of the reasons that we don't present that very often, is because it's really very challenging. And I think if you go back to using your electronic council books, so I think, Phil, you would have access to this. If you go back to previous council rounds in your drop-down menus, if you go back to the fiscal year, September, you should be able to look at the presentations and get a sense of some of that cost structure, and we can follow up and send that to you after council as well.
And Chris, if I'm not mistaken, this is still a work in progress. We haven't put this one to bed yet, right?
Yes, I think we're formulating our questions around what phase 2 of this would look like, yeah. And I think we're focused on a lot of different things right now. So we'll keep you updated on that as that progresses.
Yes.
Yeah, Pat, if I could just chime in here. So Karen, to actually get at your question, I mean, we have a strategic plan, which is pretty broad-based. It covers lots of different areas. It has 3 different themes. I mean, what I've asked the group to do, and Christy and others in DERT have been very responsive to this. I just need to get a better sense of our portfolio. I mean, what are we spending in different areas? And how do we distribute the money in such a way that we are purposefully implementing different elements of the strategic plan in the way that we want to be doing it? So getting input from council. I know that for example, I know Gary's been added to our council. There's a lot of interest in exposomics. And are we putting enough money into exposomics as a science to implement on our ideas? And of course, Gary, I see your, of course, and maybe Karen has an opinion on biochemistry. Are we putting enough money in biochemistry? No. So anyway, just we're working on that, and the DERT group has been very responsive on this. So just hang in there, but it's a real priority for me to get a better sense, the granularity of how are we spending our money in different grant mechanisms in different areas. And by the way, actually, yes, I'll add another comment. You know, animal facilities, those sorts of things. You're right; they're very expensive. We pay for those here. Those are provided as general overhead for groups that are in Bethesda. So, does that answer your question, Karen?
Yeah, no, I actually, it's just a very challenging thing to sort of decipher, and it must be a huge challenge for you, Rick. And yeah, it's just to keep those things in mind. And actually, I do some animal studies too, and those grants are not modular. You know, so you can't, even one researcher doing the same kind of research. You know, I look at genetic instability, but if I do it biochemically, I can ask modular. If it's not, I have to ask way above. And so it's hard to even say. Yeah, it's just a really challenging thing. But I guess the more data we have, the better off we are. That's all.
Well, it's challenging, but it's not unmanageable. And this isn't the first organization that I've dealt with these things. And so it's the good news is that we've got really talented people, and I'll point to Christy, she's got her camera on, but her colleagues are really good at this stuff. And I think they've done a better job, best I can tell, than any other I see across the NIH in terms of coding different grants in different categories, all referencing our strategic plan. So tell you what, stay tuned. This is a big priority for me, and the group has been very responsive, and we'll keep you posted. And then always feel free, if you've got questions about things, drop me a line or bring it up in our council meetings. You're here as advisors, and I want to hear whatever you have to say.
Thank you.
Okay, Trevor, I think Trevor was next, and then Terry.
Yeah, Andrew, we're almost at time, so if we can keep the questions brief, that would be great.
So Pat, my question is about how you calculate success rate. If you have a grant that comes in twice in the same year because it's a revised application, does it get counted once or twice?
You know, that's actually a very astute question. There is a formula that NIH uses, and it does take into account an application. I want to say it only gets counted once, but if you really want an answer you can hang your hat on, I would have to kind of come back to you about what the exact formula is. We use a kind of a formula of it's not success rate, it's kind of like funding rate
Award
or whatever.
rate.
Pardon me?
Award rate. So typically
right.
when I do an analysis, we take the easy road and do award rate. So we're counting each application as its own entity. So if it's an O1A1, it's separate from the O1. And each one of those is counted as a separate awarded, not awarded. And I call that an award rate. The NIH success rate formula, it depends. It counts as one application if it's in the same fiscal year. If it crosses fiscal years, it's counted twice.
Okay.
Tricky.
So I think it'd be nice to see what award rates are when we have a DIRT presentation as well, so we can make the distinction.
Okay, we can try to pull that together next time. Yeah. Terry, did you have a quick question?
Yeah. So back to training, and one of my favorite things to support and champion. I'm wondering if it might be useful for us to hear from you, Pat, and others, just how much training is also going on in the RPGs. And, you know, we do a lot of training. There's a lot of support for graduate students and postdocs on those types of grants, and that might help to give us a sense of the overall portfolio in terms of training. I think it's really important that you guys emphasize how much of that is actually going on. And Superfund has a training core as well. Right. So I think it would be really important to try and underscore just how much the Institute is doing, which is a lot.
Yeah, I'm sorry, you're absolutely right. Everything you just said. And I'm going to call Christy, her group has done some training analyses. And Christy, I don't know if you've looked into RO1 training processes, or if there's even a way to do that. That sounds like a tough pull, but.
Super, super hard, Terry. It's a great question. Linda previously had really tried to encourage us to look at these kinds of questions. It's really, really hard. You know, the the number of people that are included in a grant's progress report on a given year fluctuates, right? So people come on and off. And so the data, like the quality assurance associated with trying to track the complexity of that across 1,200 grants in a given year is really quite challenging. And so we haven't quite dug into that level yet.
I was just thinking maybe just a quick poll of people who are actually funded to say, are you supporting students or not? Just something like this to give a sense of that, I think would be useful.
Yeah. So Terry, just to clarify, you're asking, so within an R01, how many students are supported and how many postdocs are supported or trainees generally in that category? Is that what you're asking?
Yeah.
Yep. And that's, as you probably predict, is going to be a pretty large part of the budget for a lot of R01 grants.
I think so.
It's a really good question, but we have thought about it.
Great question. I think Lynn has a question or comment, and then Edith.
Yes, I do. So thank you, Rick. And I really appreciated the presentation. I wanted to spend a little bit more time on the issue of training. Of course, as a dean, I never think there's enough funding for training. But particularly in environmental health, it's always been tough. And it's really even tougher now than it used to be. And what I want to say is that there's something that has been going on with the pipeline for environmental health, where I've noticed, and I think many other leaders, and in universities have noticed that we don't have as many candidates flowing in as we used to. And so I really do think that there needs to be some focus on the training grants, and not just more, which of course, like I said, any dean would say we need more. I'll say that, but also thinking about what should the training programs be focused on in terms of building the scientific workforce for environmental health for the future. And I do think that the field is changing radically, and that I'm not sure that our training programs are scaled up enough to handle that, as well as focused enough on some of the changes that are happening, whether it's, incorporating the data science, incorporating the climate and health, the justice and environmental health issues, just so many areas, genomics even, which I think have been a focus for many of the centers. But I do think it would be good here to hear more about if there are analyses that are going on, and if the NAEHS has been thinking about these issues, to hear more from you about what your thinking has been, and to give us a chance to be able to respond to some of that. Thank you.
Am I hearing that perhaps there may be a workshop in order to, and I noticed that Phil Bourne also added a chat about the future of training. So are we spending enough time talking about the future of training? Could that be, for example, a topic for one of our upcoming council meetings, or could it be a workshop that we support? We support a lot of activity at the National Academy of Sciences. Would that be a topic area for one of those workshops? So actually send me your feedback on that. I'd be curious to know. And Phil, you send me your feedback on that as well. Future of training, or anyone else in council, if you have ideas about that. Edith, you've been patiently waiting with your hand up.
Sure. Well, first of all, I echo everything Lynn says about the importance of training. So I agree with that. I just wanted to put a marker in, though, as we're thinking about futures and things that'll be important, that this afternoon we'll hear about the work of the diversity group that I think is in the early stages. And I would not be surprised if there might be some suggestions that come out of there that would influence sort of some of the external and internal funding. So just wanted to throw that out there.
Great.
Yep.
Thanks for adding that. Sorry, where's Pat? Sorry, this is your Q&A. I'm sorry, I hijacked it from you.
No, thank you. No, I appreciate it. And I'm always looking for somebody to step in and answer questions. So thank you for all that. I want to mention that the chat is very active, and please go in and look at that. Some of the URLs I asked for training, for workshops and stuff. And so please look at that. So we do need to move on. We're a little bit behind. We have a couple of concepts to talk about now. And a concept is an idea that we bring to council. If we're going to be developing an initiative or a big program, we have to get your approval for. So we're going to be asking you to approve two concepts. Both of these are ongoing programs that we're asking to renew. And the first one is going to be, and let me pull up my note here, if I can, is going to be from Annika. Oh, there you are. Is it Zillinger? Sorry about that. On oceans and human health. This is a, like I say, a renewal. It's been going for several years, but I'll let her tell you all about that. So Annika, if you're ready to go.
Yes, I am.
Let's go.
Yeah, thanks, Pat. Yeah, my name is Annika Jerlinga, and I'm in the GEAMS Environment and Health branch. So as Pat said, I am pleased to present to you both an update of our Institute's efforts in oceans and human health, as well as a vision for a renewal of this program and the future of the portfolio. I'm going to start this presentation by impressing upon you the sheer breadth of this program. Try to get a laser pointer, actually. There we go. So yeah, the sheer breadth of this program in terms of activities and where our interest lies contextually within the federal government. So throughout this presentation, it will be clear how the program embodies the values and priorities set by NAEHS over the last several years. We just mentioned the strategic plan. So specifically, our 4 centers for oceans and human health are by design strongly interdisciplinary, bridging basic molecular biology and toxicology to oceanography and computational geosciences. So in advancing environmental health sciences, our OHH researchers are driven by questions about what drives population susceptibility, how do ocean-related exposures interact in the environment and inside the human body, and how can we deepen understanding of toxicity concerns for emerging contaminants? In promoting translation, how can we learn from and understand past exposures to inform future risk? And importantly, how can we share that data with researchers and with the public? Our researchers brainstorm and implement strategies alongside community partners to mitigate public exposure, develop more accessible informational campaigns, and recruit citizen scientists to acquire otherwise inaccessible data. Our OHH researchers are committed to enhancing environmental health sciences through stewardship by forging new collaborations with local colleges and community advocacy groups, providing unique opportunities for students and postdoctoral trainees, and by undergoing continual introspection and evaluation of their own research and engagement impacts. Federal, academic, and community partners. Keep advancing too quickly. All right. Federal and academic and community partners engaged in ocean sciences research practice a One Health approach, which is an approach that recognizes the interdependence of human and animal and environmental data, and that a holistic approach to the well-being of all will lead to improved health outcomes and enhanced resilience of communities. And so on this slide, I just have a list of the interagency activities we have going on for oceans and human health. The most tangible example is our role in the field of oceans of the NSF and NIEHS collaborative. So I'm going to talk about this a lot in this presentation, obviously, but it's been a partnership that's been going on for 20 years. We have a seat representing the NIH on the White House Subcommittee on Ocean Science and Technology, which meets biannually in its effort to identify ocean science and technology priorities and collaborative interagency strategies. And then reporting to SOST, we sit on 2 working groups. So one is the Harmful Algal Blooms and Hypoxia Research and Control Act, bringing together NOAA, EPA, CDC, NSF, and other agencies on a bi-monthly basis to discuss new regulations, emerging areas of concern, and to hear directly from researchers. And then the Ocean Decade subgroup is engaged in coordinating activities that fall under the United Nations Ocean Decade activities. Speaking of which, the United Nations has proclaimed a decade of ocean science for sustainable development, which is ongoing from 2021 to 2030. The purpose is to make a major global push to support efforts to reverse the cycle of decline in our oceans, gathering stakeholders worldwide behind a common framework to overcome 10 major ocean decade challenges. I've highlighted 3 of them here that I see as most closely aligning to our mission at NAEHS, and that's to understand and beat marine pollution, increase community resilience to ocean hazards, and to promote skills, knowledge, and technology for all. So bearing this global and federal context in mind, I'm going to have some background slides on what the critical issues are for ocean health and ocean sciences as they interface with human health. So a crucial first premise of the oceans and human health concept is the very importance of oceans and Great Lakes, as well as other large bodies of water to humans and our well-being. About 1/3 of the total human population lives within 60 miles of an oceanic coast. 60 million people are employed worldwide in fishing and fish farming industries, contributing to a $1.5 trillion economy. The Great Lakes accounts for 1/5 of the freshwater surface on the planet. The ocean influences the health of so many, and it will take team-based approaches, such as our very own Oceans and Human Health program, to make meaningful change. And this brings me to my next premise, which is environmental stewardship. The ocean is a complex mixture of metals, legacy, and new chemical contaminants, pesticides, and most visibly, plastic pollution. More than 80% of ocean pollution arises from land-based sources. It reaches oceans through rivers, runoff, and discharges. The toll that human substances entering the aquatic environment takes on the ocean feeds back into our whole ecosystem. This represents a critical problem requiring multi-pronged strategies to address. In terms of NIEHS's interest in ocean topics, you can imagine that there are quite a few priorities at the nexus of this research. And these priorities vary drastically depending on the region that you're talking about. So as indicated in my previous slide, the ocean is rife with anthropogenic exposures. Additionally, there are harmful algal blooms and other natural toxins, which plague both marine and fresh water, disrupting the food chain, water quality, and human health directly. Add to this extreme weather events you find along the coast, such as hurricanes and flooding, and this culminates with other considerations of local population susceptibilities, such as lower socioeconomic levels of long-term residents. Put that together with a part-time retired elderly population and the large tourism industry in many of these areas, and we have a fairly diverse array of situational exposures and intersecting susceptibilities in the balance. Spanning all of these topics is, of course, climate change. It makes these situations worse and less predictable and all the more urgent to address. For nearly 2 decades, the NIEHS has partnered with the National Science Foundation on a focused effort to address some of these crucial topics related to oceans and human health. The thesis is to promote interdisciplinary collaborations among biomedical researchers, physical and oceanographic scientists, and community partners to gain knowledge of the impact of marine environmental exposures on human health and strategize ways to adapt, prevent, and counteract these exposures to improve the lives of populations in that area. This spiral figure is a visual walk through history of the most prevalent topics covered by the ocean centers over the last 20 years. And some of these topics I will delve into further during this presentation. I just thought it's really neat to have 20 years worth of data to really look back on. Here are the currently active centers and researchers from the last Oceans and Human Health RFA, which was published in 2016. The 4 PO1 centers are located in Woods Hole, Massachusetts, Charleston, South Carolina, along the Gulf Coast, headquartered at Fort Myers, Florida, and the Great Lakes at Bowling Green State University on Lake Erie. Additionally, there were 4 RO1s, 2 in San Diego, 1 in Washington, and 1 in Maryland. Thus, we have a nice geographic and scientific distribution for oceans research, contributing to a variety of types of toxins and pollutants covered. In fact, this graph has the entire solicited and unsolicited portfolio for oceans related topics. And we have a fairly even distribution across chemical pollutants, HAB toxins, other natural toxins, and climate change. And I'm going to go over some specific examples of these topics. So as I've mentioned already, much of the OHH portfolio is committed to understanding the dynamics and hazards of toxins derived from harmful algal blooms. And before I dig into specific examples, I just wanted to convey the overall significance of studying these natural events. HABs are essentially what they sound like, an overgrowth of algae dominated by a species that's toxic to the marine or freshwater environment and to humans, either directly or indirectly. Growth conditions of HABs depend on a number of environmental factors. HABs need sunlight, slow-moving water, and essential nutrients to thrive, or bloom, if you will. Nutrient pollution from human activities and warming water from climate change make the problem worse, leading to more severe blooms that occur more often and last for longer. Some algal blooms produce substances that are acutely toxic to humans who are exposed in a myriad of ways and circumstances. And some of the notable health concerns, depending on the toxin and exposure route, are respiratory, liver toxicity, skin rash, and neurological effects. Harmful algal blooms cause thickening and discoloration of water that impacts water quality, recreation, businesses, and property values. They can be directly toxic to wildlife and create hypoxic dead zones, contributing to an overall environment unconducive to aquatic animals. There are many lines of inquiry into HABs in our OHH portfolio, from characterization of HABs to exploring mitigation strategies and studying health effects of chronic exposure, just to give you an appreciation of scope before I dive into specific examples. Our researchers, particularly at the Great Lakes Center and Woods Hole, where this example is from, use process-based modeling techniques to predict harmful algal bloom distribution. In this case, Alexandrium catenella, which is the causative agent for paralytic shellfish poisoning in the Gulf of Maine. Some of the data inputs for this modeling are satellite Earth observation of ocean color, in situ sensors or species-specific probes, environmental data over that period of time, and just knowledge of characteristics of different algae. For example, genetic distinctions, preferences for nutrient salinity or temperature in the water, swimming movement, life cycle, things like that. In this example, there was a discrepancy between modeled and observed chlorophyll concentrations that was ultimately proposed to be due to a joint effect of upward swimming of algae toward light, horizontal convergence, and wind-driven flow. So this comprehensive database of information is very useful. Some key challenges for HAB forecasting are the limited high-quality data in most regions that are experiencing HAB outbreaks, and little to no data in regions expected to start experiencing HABs in the near future. Secondly, understanding the extent to which climate change impacts HAB blooms, how to incorporate those factors into modeling paradigms that have existed for a while. So it's been a really interesting field to take a look at. I have a few toxicology related examples to share. First, we have researchers at the University of South Carolina studying the health effects of microcystin, the most widely known toxin from freshwater cyanobacteria, commonly associated with liver toxicity. In a mouse model, they have seen that microcystin, in fact, also targets the gut microbiome, which may contribute to hepatic inflammation and other metabolic and even neuroinflammatory outcomes. Additionally, researchers at the Gulf Coast have looked at novel routes of metabolism of ciguatoxins in marine food webs. Several researchers are studying the toxicity of domoic acid produced by members of the Pseudonycha genus, which causes fatal amnesic shellfish poisoning with high levels of contaminated seafood consumption. Chronic lower level exposure is still understudied. And at Woods Hole, this is being studied with a zebrafish model. Recent findings indicate a critical window of exposure during which myelination development is disrupted. In Washington state, researchers have identified a domoic acid specific antibody in serum of human shellfish consumers, confirming the level to which Pacific Northwest razor clam harvesters and consumers are systemically exposed and may prove to be a useful diagnostic biomarker in the future. Oceans-related human health concerns especially affect coastal communities, particularly those dependent on the oceans for their food and livelihood. The effects of pollution and climate change fall especially heavily on populations that don't have the resources or infrastructure to combat the impacts and are highly susceptible to increasingly frequent HAB events, for example. Working with local partners, examples of which are listed on this slide, significantly increases success and speeds up development of strategies to adapt or counteract, prevent and protect from these exposures. And I have a few examples of this to go over as well. The first examples are monitoring programs that the centers are involved in. On the top is the Hui Hab Hub portal, which allows for real-time sharing of bloom observations up the Northeast coast. There are several contributors to this portal, and it's only growing. In South Carolina, members of the center contribute to the South Carolina Check My Beach website to update safe swimming advisories based partly on the presence of marine toxins. The Great Lakes Center enlists the help of charter boat captains to provide additional sampling depth during routine monitoring of Lake Erie. They've also partnered with the Coast Guard for off-season sampling and occasionally work with other schools in the area to do a HABS grab, which is a one-day event of sampling dozens of locations at the exact same time. We've seen a grantee-driven push in terms of reaching out to healthcare professionals at the local and national level to ensure that they're adequately informed of symptoms related to acute toxicity from marine toxins, and in this case through a podcast on ciguatera fish poisoning. In another fun example of communication strategies, a trainee at the University of South Carolina produced a documentary on macroplastics in South Carolina waters. Finally, on the topic of data informing policy, so some of our OHH researchers, including those at University of South Carolina and Bowling Green State, were actually well poised to pivot to or add on SARS-CoV-2 sampling and wastewater to aid in public health decision-making throughout this pandemic, actually working with local government partners for effective translation. At Bowling Green State, researchers have also worked with the Ohio EPA to develop a framework to determine whether bloom severity should preclude recreational lake activity at a given time, using this satellite-derived estimate of cyano-HAB coverage of Western Lake Erie, as you can see in the picture. Okay, so after my whirlwind summary of major topics for oceans and human health studies and an overview of what our centers have been working on, which is a lot, I will now discuss a vision for the next era of oceans and human health. In short, all the topics I've discussed continue to be of crucial public health interest. These topics should be addressed using a combination of multi-component center-like approaches and specific RFA mechanisms to address critical gaps of knowledge. The interdisciplinary centers, jointly supported by NAEHS and NSF, provide, as I've said, an extremely rare opportunity for biomedical researchers and oceanographers, physical scientists, chemists, and community partners to investigate different elements of the same environmental exposure in the same place and inform each other's work in real time. The way this has worked so far has been exceptional. And importantly, NSF is also eager to continue this partnership. Like the last iteration, I proposed the Renewed Centers program will require at least 3 distinct research projects focused on toxicology or human health impacts, another on further characterizing the marine or Great Lakes exposure of interest, and the direct impact of climate change. So the impact of climate change was actually a new feature in the last RFA. And I've touched on this a bit through my presentation, the intimate relationship between ocean health and climate change. The renewal would once again require inclusion of a community engagement core to establish and/or deepen relationships with community partners and an administrative core. Due to the geographic distribution of interested applicants and the location-specific exposures they're likely to study, it's hard to be much more prescriptive than this. In my view, there are some gaps I would like to see emphasized in upcoming oceans funding opportunities. Again, this could come through the centers or NAEHS funded specific solicitations or through new partnerships with other agencies as opportunities arise over the next few years. The first is co-exposures or combined susceptibilities. It's an element to some of the studies already, but I think it's an important one to consider growing, especially for the populations most likely to be exposed to these marine toxins and ocean pollutants. If you have chronic mercury exposure and a bloom happens, for example, or multiple HAB toxins from different sources or by different routes of exposure. Next would be a stronger characterization of human exposure to aquatic toxins. Exactly how much exposure populations have to natural toxins is not fully appreciated, especially for long-term residents. I think there's an opportunity for exposure modeling or strategic sampling to get a better idea. And then two specific exposures I see as becoming more critical to research are microplastics and freshwater harmful algal blooms. And I'll go over these in a little bit more detail quickly before I'm done with my presentation. So microplastics are plastic particles with a diameter of less than 5 millimeters. They've received wide attention in recent years, but there's still very limited data regarding the risks of microplastics to humans. There's evidence that humans are exposed to microplastics through food or drinking water, though some suggest the greatest risks are associated with consumption of small fish, such as sardines that are eaten whole. In rodents, microplastics have been shown to accumulate in different tissues, depending on the size, of course, and there's some evidence for direct microplastic toxicity and concern for indirect toxicity. Directly, for example, in rodent models, microplastics have been shown to disrupt the microbiome, induce intestinal barrier dysfunction, and promote metabolic disorders. And then indirectly, there's concern of microplastics acting as a vector for transport and shelter of hazardous chemicals or microorganisms that harbor marine toxins as they can form a biofilm on the surface. Microplastics could potentiate the toxicity of other ocean pollutants. There's still a lot left to learn in this field, especially considering how much plastic waste is in our oceans and waterways. There's a large geographic and ecological gap of knowledge when it comes to harmful algal blooms from freshwater bodies. Using this map of our currently funded research just as an example, there are plenty of communities and local agencies across the middle of the country that could use additional toxicity, exposure, and bloom dynamics data. Although it may seem a misnomer for the oceans program to continue to expand into freshwater, many of the same principles of studying marine HABs apply to freshwater HABs. Many freshwater rivers and estuaries flow into the ocean, creating a gradient of algae and toxins and populations that are likely exposed to both. Although microcystin, a hepatotoxin that I've talked about a few slides ago, was originally coined the fast death factor. It's the most widely studied class. Cyanobacteria actually produce hundreds of understudied cyanopeptides. There's not much known about the toxicity of many of these classes, but this short study shows ranges of IC50 values for different classes in an enzyme inhibition study, showing that although microcystins are indeed among the most potent, they're in good company with several other cyanopeptide classes not far behind. Cyanoblooms are occurring more frequently and last for longer as a result of polluted waters, sourcing bacteria with nitrogen and phosphorus, and warming waters, creating necessary growing conditions. Treating water for blooms using nutrient treatments or other methods may in fact create conditions that are favorable to different cyanobacteria. So it's important to understand the hazard of multiple different classes and the conditions that lead to growth of different bacteria and dispersal of the toxins that they produce. With that, we've reached the conclusion of my overview of the current OHH program and a preview into what the future holds. I want to extend acknowledgement to those who've played such a pivotal role over the years, making this program the success it is. my NSF counterpart, Hetty Edmonds, who's been an exceptional advocate and collaborator, scientific review officer, Linda Bass, program analyst, Alicia Ramsaran, and Fred Tyson, from whom I assumed this portfolio in the last year. He started the program and was an excellent source of guidance. Programs such as this require a lot of effort on the part of many people in our division. So I want to extend an additional thanks to Michelle Victorino and Kendra Morrison for the work they did in grants management and scientific review during the last RFA, from which I pulled examples today. And I would like to thank Cindy Lawler, my branch chief, for her support of this program, as well as the broader DERT and NAEHS leadership. Thank you all for your attention. I very much welcome discussion on these topics. We've invited Drs. Robin Tangway and Edith Parker to lead the discussion. So at this time, I'd love to turn it over to Robin.
Okay, great. Thank you, Anika. That was great. I'll keep my comments brief. I'm very supportive. This has been such a successful program for the last 20 years. It's an enormous challenge. I mean, of course, everyone should throw more money at it. I think some of the strengths, in addition to the human health aspects where folks may be interested and concerned about their human health, I think that the economic drivers for this program are probably even more important, considering beaches might get shut down and whole industries could be lost with just one announcement. So I think the engagement of the public and those stakeholders is probably one of the strongest parts of this. It probably even, I would say, supersedes some of the science, but I'll just say that just because I think the NIH having a presence in those communities is really advances the strategic plan of NIEHS in such a huge way. I think that emphasizing the impact of climate change on some of these challenges, I think is obviously timely with climate change. But I do think there may be opportunities to even further leverage the partnership with NSF, which again is fantastic that they're at the table. But I do wonder if you thought, as you put this program together, having more elements of innovation. So I'm thinking of my experience with the Superfund research program, and Bill's on the call here, but the mandate 4 of the SRP has an element of remediation or some technology developed kind of in the engineering space. And I assume that NSF would be handling that, but it's not clear because it seemed like that's more oceanography type measures. So I just wonder when you think about some of these contaminants, and I know it's a challenge, it's a challenge in freshwater and certainly in the marine environment to do anything about these outbreaks in the blooms, for example. But I wonder if incentivizing innovation in that space of reducing exposure might be something to maybe emphasize a bit more. And then finally, and we talked briefly about this, the emphasis on microplastic. I think there's certainly a global interest in that challenge. And again, I think that from my perspective, it seems like that's an exposure and that's a consumer use and the way we behave with that particular material. That seems to should be more of the emphasis, because I mean, I personally don't think I need to know more about microplastic to tell me we shouldn't be putting it in the environment. So I would hope that the program doesn't focus too much on the kind of descriptive science of exposures of various types of microplastic and see what happens. I think maybe more advanced thinking on how you're going to handle that particular emerging contaminant. But overall, I think it's a fantastic program, and I think you're in good shape of getting some really good applications from the core centers and also in the R01 space. But I'll pass it to Edith now.
Thanks, Robin. I think we're very much in line. I think I'm very, very impressed with the program and really think that it's done some great stuff. Like Robin, I really think that the stakeholder and community engagement is just such a strength. One that I think you and I talked, I think you should even make sure the centers highlight more, because I think it really is just some really great work and a bit different from some of the other community engagement of some of the other programs. A couple of things. I love the NSF NAEHS. I'd love to see that model kind of maybe with some of the climate change so that there'd be no more partnering. I think some things to think about is how this program, or rather how the climate change and health initiative may interact with this program. And as you and I discussed, I think it's difficult to know now because that program has not yet rolled out, but this is probably the time to be thinking about that. I also think one other, and this is not a critique of this concept, it just is a challenge that I think is becoming more and more critical and timely for us. And you know, I picked up the paper last night and saw the NOAA report that the sea levels will rise by a foot by. So the future's here now. And my point, and I don't know that I have an answer for this or want one, but how can we make sure that the research findings that we're having, not just of this, but also the climate and health, are translated really quickly to other communities? I mean, it's a great map with some geographical distribution, but these are issues that are going to face all, as you're saying, inland and coastal communities. And I was struck by like the map that shows the satellite derived estimates to look at some of the HABs and how that might be relevant for all the inland states that are right now measuring by taking water samples and doing a more labor intensive. So, and how do we get that out? Is it a translation core? And I think to Robin's point, if we're doing more mitigation, when we get those discoveries out, how do we push them out much quicker? That's not necessarily a research question, or maybe it is. Maybe it's an implementation research question of how to get uptake of these things, because the urgency of this issue with the oceans, and I think with the climate, are unlike probably anything we've ever seen. So I'll stop there, but very favorably impressed.
Thanks. Are there any other questions or comments for Annika? Terry, looks like you got your hand.
Annika, thank you for that really great presentation. Very impressive program. I'm very highly supportive of it. One of the things I was wondering about in terms of leveraging the program and getting additional support, you know, the United States has a couple of treaties, one of them with Canada and one of Mexico, that actually deal with boundary waters and marine borders. And I'm wondering whether or not, for instance, it's your International Joint Commission with the with Canada, whether or not some of the resources or perhaps coordination with Canadian and Mexican scientists who are also looking into these issues might be useful, considering our joint interests in this.
Yeah, thank you. That's a quick one to address too. Yeah, I brought that up with some of our researchers up in the Northeast, and they are trying to work with Canada, but that's something to consider for Gulf Coast too. I know they also have some international collaboration. So we absolutely appreciate that. Thank you.
Yeah, Trevor, Penny.
I really enjoyed this presentation. I think it's a very important program. My question to you is relates out of experience I had with Governor Jeb Bush, who was the governor of Florida several years ago. And in the time he was governor, Florida experienced 3 hurricanes, one after the other, that were very devastating. And it took him to the 3rd hurricane to realize the biggest issue he was facing with human health was mental health. And this was related to people losing everything, losing their home, losing their livelihood, losing their car. So what do you do when you've lost everything? And so I think a component of this moving forward has to be the mental health component. And it might actually make a nice bridge with the initiative in environmental neuroscience that Rick spoke of yesterday.
Yeah, thank you for that. Yeah, I've been part of our internal conversations for the climate change and human health activities has also very much focused on that. So that is an element that we certainly are considering.
Great. So we have 3 hands up. I'm going to ask that we have Andrew, Irva, and then Marla, and make that Marla our last question in the interest of time. So Andrew.
Thanks very much. And thank you, Monica, for that presentation. I've got maybe a two-parter, but I'll keep it short, Pat. One question is whether you're leveraging any partnerships with the Superfund research program. I'm glad that Robin brought that up initially, because particularly around the Great Lakes, but also in coastal areas, there's so much of an issue with contaminated sediments. The microplastics are a component of that, and as you referenced, maybe a secondary source. The issues of passive sampling and all of those other things are critically important. The second part of my question is actually whether you're also leveraging with groups working on the Great Lakes Legacy Act and the areas of concern. In the AOCs around the Great Lakes, there are these defined areas of concern where communities actually define what are called beneficial use impairments. And then the goal is to remove those impairments to allow fishing and recreational swimming and commercial fishing and freshwater use for freshwater, et cetera, et cetera. So the goals of the research, it's very clearly operationalized with clear economic drivers, is to remove these impairments. And so if you're looking for, clear applications of the work, and this certainly would apply in the Chesapeake Bay or anywhere else, this would be a strong driver and a strong orientation as well.
Yeah, I think kind of a similar answer for both of those is I appreciate you bringing this up, because especially as I look further into pursuing the freshwater HAB line of investigation, I think leveraging these additional resources is going to be very useful to make a bigger impact than it would otherwise. Thank you so much.
You bet.
Thanks. Marla.
Hi everyone. I apologize in advance. My internet is not doing too great. It's acting up. But my question, oh, by the way, excellent presentation. I really like the concept. But I have a question about how would you align the concept of hypothesis-driven research with the concept of community engagement? The data suggests, and the literature on community engagement suggests that community engagement is not a project-based endeavor, but more like a relationship building process across time. So how would you promote the establishment of relationships in a hypothesis-driven research environment? And how would you, built in the concept, guarantee that the idea of stakeholder engagement doesn't become basically extraction of community resources like time, effort, data, etc. So yeah, that's about it.
Yeah, what's really interesting about these centers is that they're so focused on an exposure that really is endemic to that area. And it's really an iterative process. So, the researchers who are doing the hypothesis-driven research kind of really trying to dig into the exposures, conditions that are favorable to toxin dispersal, for example, or trying to understand the human health impacts. In a lot of cases, the communities are already recognizing that exposure is a problem that they want to learn more about. And so it's great to see, depending on the stakeholder, depending on the center, the back and forth that they have. So be it by town hall meetings or surveys, developing curricula, that kind of thing. So I really think they do a beautiful job of it really being an iterative process, working together and having that back and forth. So thank you so much for bringing those concerns and making sure that we're continuing to consider that.
All right, thank you. Great feedback and great questions. Thank you for your engagement there. So, and Annika, thank you for a great presentation. I will need to ask for a motion to approve this concept for us to move forward with it.
So moved.
Thank you. And a second?
Second.
Second. Any discussion further? If not, I will ask you to vote in your electronic voting site there. And Liz, let me know when we have everyone voted. Just to get started here, our next event here is going to be another concept, as I mentioned, from Sri Nadu, and also continuation of a program, although a slightly different way, from our Counteract program. And as soon as we finish voting, we'll get that started.
We have quorum.
There you go. All right, thank you, Liz. So as I mentioned, our next speaker is Sri Nadu. He'll be talking about the direction for the Counteract program, and I will ask John to pull up his slides, and when they're ready, Sri, take it away.
Thanks, Pat. Good afternoon and good morning to some of you in the West Coast. I would like to share with you this concept to support an inhalational exposure resource and coordination core to support the chemical countermeasures research program. This is a joint effort with the National Institute of Allergic and Infectious Diseases, and Dave Young from the CCRP program is available on Zoom if you have any specific questions for him. And Jackie Majek in our branch is supporting me with this program, both in the development and the administration of this program. Next slide, please. At the last February Council, I gave you a presentation on the contract program when we brought a concept to support a research RO1 program. So in the interest of time and also for the benefit of the new members of the Council, let me provide you a brief overview. The Public Health Emergency Medical Countermeasures Enterprise coordinates federal efforts across different agencies in the mission of to safeguard and prepare the country to handle any potential high consequence public health emergency resulting either from intentional or accidental exposure to chemical, biological, radiological, nuclear agents against the civilian population, as well as any emerging infectious diseases like what we have been handling for the past 3 years. Efforts across the federal agencies such as Department of Homeland Security, VA, USDA are all coordinated under the leadership of the Assistant Secretary for Preparedness and Response at the Department of Health and Human Services. The directors of CDC, NIAID, and the Commissioner of FDA serve as core members of this enterprise. NIH plays the foundational essential role by supporting early stage discovery towards medical countermeasures development. Within NIH, in the Office of the Research, Biodefense Research and Surety, the program of Chemical Countermeasures Research Program is located and supports all these efforts as an extramural research program. May I have next slide, please? The major focus of the Chemical Countermeasures Research Program is to support research and discovery of medical countermeasures to advance the nation's medical and public health preparedness and respond and recovery from any disasters of high consequence chemical emergencies. There are about 200 chemicals identified as chemicals of concern by the Department of Homeland Security. Of these, about 1/4 of them, 50 chemicals, are known pulmonary toxicants. The goals of and the priorities of this program is to understand immediate and long-term pathophysiology associated with acute exposure and guide the development of therapeutics ready to be administered in the field within a short time of window, and also therapeutics to be used as for delayed effects in the hospital settings. May I have next slide, please? The countermeasures development program is completely supported through an extramural research effort. Under the umbrella of the NIH-wide Counteract program, there are 6 institutes involved in this program, and we, the NIEHS, is the lead for the pulmonary toxicants program. The CCRP also, through an interagency agreement, supports a vibrant research program at the Defense Institute, and also has contract mechanisms to support the developments from the extramural research programs, such as a preclinical contract facility or the efficacy research facility in supporting the extramural grantees when their medical countermeasures are in advanced stage to get pharmacokinetics or toxicokinetics data, or even synthesis of the countermeasures being explored from these programs. And this program also has a small SBIR STTR program aimed at bringing in the small pharma in the field of the chemical injury space. May I have the next slide, please? The extramural research program has multiple funding opportunities. And the one I presented to you in the last February Council is to develop the discovery pipeline through the R01 program. The other funding mechanisms are aimed at supporting characterization of acute pathophysiology and exploratory efforts on identification of potential therapeutic targets, characterization of lead candidate medical countermeasures, and its optimization by structure-activity relationship or developing pharmacokinetics or toxicokinetics, and position these identified medical countermeasures towards advanced drug development to be supported by BARDA transition. However, let me share with you some promising candidates. May I have the next slide, please? Sorry. Yeah, let me share with you some promising candidates from currently funded efforts within the pulmonary toxicant program. Brian Day's group at the National Jewish Hospital aims to determine whether sodium thiosulfate, which is an FDA-approved chemical countermeasure against cyanide poisoning, can be repurposed to treat chlorine-induced lung injury. And using a mouse and swine model, Svenzot and Satya Achanta at Duke University are exploring 2 chemically distinct third-generation transient receptor potential ankyrin 1 inhibitors, as well as the pro-resolving lipid mediator resolving D1 to reduce the acute lung injury and inflammation. Sadie Madelon's group, based on their observation of degradation of hyaluron by bromine and brominated lipids to low molecular weight fragments, are investigating the efficacy of intranasal administration of high molecular weight hyaluron to reverse airway injury, inflammation, and mortality using their mouse model. Jerry Boss at University of California, San Diego, as part of the U54 Center based in University of Colorado, is exploring the role of vitamin B12, a cobalamin or analog cobalamide, which is in advanced stage of development for cyanide poisoning, and he's trying to repurpose these for methyl mercaptan toxicity. We have one active U54 center at the UAB, at the University of Alabama, Birmingham, focused on arsenicals. They are looking at the acute and delayed cutaneous pulmonary and renal damage following cutaneous exposures to lucite and other arsenicals. The multi-organ inflammation and pathology is driven by the epigenetic reader bromodomain 4, and their medical countermeasure efforts are all focused on screening a small molecular library to inhibit the bromodomain 4. May I have next slide, please? As I shown in the earlier slide, our focused efforts are on very limited number of chemicals. If you can, majority of those chemicals are either chemical warfare agents such as chlorine, sulfur mustard, or lucide, or industrial chemicals such as methyl isocyanate or acrolein. As I mentioned in the last council, and we have more than 50 chemicals identified by the Department of Homeland Security as potential chemicals of threat. And of the 50 industrial, the pulmonary toxicants, majority of them are either industrial or agricultural chemicals, which has a potential for accidental exposure or even intentional exposure. When we look at these more 50 or odd pulmonary toxicants, we have very limited toxicology data on them, whether they are mostly understudied. And what we have is a LD50 or LC50 information, some gross pathology or limited pathophysiological understanding. I listed here the link to the RFA that the council approved last February, and we have solicited applications. And we have a very good response for that RFA. May I have the next slide, please? So what we learned from the issue of that RFA is we got a very great response from the extramural community. And we are glad to know that this RFA has stimulated interest with numerous inquiries from current and notably new investigators not currently supported by the contract program. But these are the new investigators with background and expertise in pathology, pharmacology, and drug development. Along with this, we also heard that these new cohort of investigators expressed their inability to carry out research in the absence of access to an inhalation facility, either within their campus or in proximity. So there are only few dedicated inhalation exposure facilities available within the US, and most of them are used for investigating diverse air pollutants such as ozone or particulate matter. But some of these exposure facilities can be converted to use chemical exposures or the chemicals from this list I have shown. May I have the next slide, please? In this slide, I just want to show you a typical exposure facility. The one on the on the left, where I have shown a particulate matter exposure facility. It's a dedicated facility that can expose at least 8 to 10 animals in one exposure chamber. Within the program, the currently supported program, we have a range of exposure of facilities available. For example, the one I showed on the right is the exposure chamber used by Sadie Madlon's group at the University of Alabama. They have designated a hood within the lab as for the exposure, either using the mouse model or the rabbit model. And this small exposure chamber is made for exposing bromine or other gaseous compounds like chlorine. May I have the next slide, please? On the other hand, within the program, we have a well-established ICU-like facility to expose the swine model to chlorine at the Duke University, run by both Svenzor and Achenta. So what we need for the program is a dedicated facility that's somewhere in between and better than what we can do as within a lab as a dedicated facility to support the exposure. May I have the next slide, please? Excuse me. So to advance the medical countermeasure development, what we need is a dedicated facility capable of performing inhalational exposure for chemicals of concern for this program. To address this immediate and recognized need of the program, what we propose here is a concept to support establishing inhalational exposure resource for the program. We envision that such a resource core to contain three components: a research component and an administrative and a coordination component. I will explain in detail about what these three components can contribute to in the next slides. May I have the next slide, please? So the research component will develop exposure protocols for a wide array of toxic chemicals and stand as a state-of-the-art exposure facility with a built-in safety and security monitoring tools. Will have an established quality control rigor and reproducibility for exposure and for capable of carrying out both whole body, nose only, or any other special needs, and using a diverse animal models ranging from mouse, rat, rabbit, or swine. Of course, having exposure facilities dedicated for swine will be an expensive affair, but if we could get one such exposure chamber for a swine model, it will be definitely an asset for the program. Along with standardized exposure protocols, this core can work with grantees in developing real-time aerosol concentration monitoring, dosimetry, as well as support with telemetry or live animal imaging or other needs as needed by the grantee community. The core also should have options to provide a dedicated space and expertise if required for tissue harvesting or other pathology to be supported by the grantees. May I have the next slide, please? We envision that the administrative roles of the core to include overall supervision of the core activities, working with the grantees in developing protocols, obtain required IOCOC approvals, and handling the toxic chemicals that are supposed to be used by the grantee community, and in collaboration, coordination with the grantees to procure and have those chemicals ready for exposure. While the coordination component will serve as the interface between the grantee community in scheduling access, develop exposure and biological parameters to be monitored, and oversight, including veterinary care. May I have the next slide, please? So in summary, with your support and approval, we would like to establish a dedicated inhalational exposure core network as a resource to support the chemical countermeasures research program and broader chemical communities. And this will serve as a state-of-the-art exposure facility for toxic chemical agents, particularly the chemicals of concern for the program. And in that way, advance the discovery and early stage development of medical countermeasures through the extramural efforts supported to the investigators. As well as these efforts will support in expanding the toxicological and pathological database of diverse chemicals of concerns in support of the core mission of the emergency preparedness and medical countermeasure development. May I have the next slide, please? Thank you for your attention, and I will hope this is open for discussion, and Drs. Terry Kavanaugh and Andrew Holian as the primary reviewers for this concept. Thank you. Thanks, John.
Terry, you want to take it away?
Okay, thanks, Sri, for that presentation. Overall, I'm very supportive of not only the entire program, but of also advancing the program by providing this resource. It's been, as Sri has said, from review from his group and colleagues around the country who've been engaged in this program, there is a limitation with respect to the availability of professional and advanced exposure facilities. These will have unique capabilities, not only to look at real-time monitoring of exposures and appropriately measuring those exposures and doing the dosimetry, which is a critical aspect of this, but also having the additional safety and security measures that are necessary, especially for some of those agents that might be select agents, for instance, that require additional security. And so I think it's an essential part of this program to continue to advance the science. One of the things that will be challenging, of course, will be the administrative access that's given to researchers, not only within the Corps, of course, but for partnering researchers in the CCRP program to be sure that they have all of the necessary training and certifications and so forth to work in such an environment. We've talked about that. Also, and particularly for the select agents, which Sri can't talk about, nor neither can I, because I don't know about them. But these will be particularly challenging, I think, and so this needs to be kept in mind. But this also provides an opportunity, because I love to talk about training, for veterinary staff and for comparative medicine programs and veterinary science programs to also be involved. Their expertise is particularly important in carrying out these programs, and I believe this is also a need to get specific training in threat agents and so forth, and industrial accidents and so forth for this community of veterinary scientists. We've talked a little bit about the actual implementation of the medical countermeasures and developing and repurposing existing drugs or drugs that might have failed FDA approval, but could be used for a particular application, but could be repurposed for medical countermeasures and some of the challenges there. And I appreciate the fact that Sri has pointed out that although big pharma may not be interested in this, there are plenty of smaller pharmaceutical industries and biotech companies that might jump at the chance to be involved in this program in this way. And I guess finally, I see an opportunity here to also coordinate these kinds of exposure facilities with the exposures that are going on in other model systems besides whole animals, including in vitro and microphysiological systems and so forth, to try and get more details on potential mechanisms of action and medical countermeasures. So I encourage that as well. That's all I have. Andre?
Terry, I think you covered everything really well. My take on it is very similar, very highly supportive of this. I feel that the ability to conduct reliable, reproducible exposures is essentially a rate limiting step at this point to really move the countermeasures program forward. And having these types of facilities that can coordinate with each other, because I believe this is probably going to be some kind of a U mechanism, I assume, that will allow a very close coordination and collaboration with NAEHS, that they will be able to benefit from each other, benefit from this coordination and be able to conduct this work. I think importantly, it will allow a lot of new investigators who don't have normal access to this, but have the techniques to really analyze the outcomes, to be able to work together with these exposure facilities. So I think that's going to be a major step forward. Overall, the opportunity for new collaborations I see here is really being huge, having a reliable facility, and also it will give these facilities the opportunity to set up new types of monitoring for the health of these animals and the outcomes that aren't necessarily available and even in the existing ones that can be put in because of the need for those types of measurements to be done, in addition to, good pulmonary function testing, other telemetry outputs that are being developed. I was listening to a lot of the excellent presentations yesterday at the meeting. The future is out there to be able to do a lot of these new technologies that could be incorporated here into these core facilities. That's it.
Thank you. Any other questions of Shri or any comments about the program from the rest of council? If not, I will entertain a motion to approve this concept to go forward.
Motion.
So
Second.
moved. Second. Any discussions or anything? If not, I will ask council to electronically vote their approval for this concept in their council book. Liz, you'll let me know when we're finished up.
Yes.
After this, we are back on schedule. Thanks to our last two speakers. Good job. We will break for about 15 minutes and I'll ask you to come back at 1:30 Eastern time. But let's wait just a minute to make sure everybody has voted.
We have quorum.
We do. Terrific. Thank you, Liz. All right. Have a break here and we'll see you back in about 15 or 16 minutes. Thank you.
Right.